Informed consent implicates law, medicine, and bioethics. Patients must understand treatment's risks, benefits, and side effects. Patients have to understand what might constitute medical malpractice and what the boundaries of consent are. And it raises bioethics principles like autonomy, beneficence, and justice. Informed consent is especially important within ART or assisted reproductive technologies because treatments like IVF raise unique legal and ethical concerns, often implicating parental rights or embryo dispositions. At this point, satisfying informed consent requirements means giving patients lengthy informed consent documents. And although ASRM has designed model consent forms, there aren't any universal requirements for clinics to follow, although there are some state laws involving third-party reproduction. Clinicians want to help patients make good treatment decisions, but they also have to respond to productivity concerns. We often wonder how many patients read or understand their consent documents. Documents might make informed consent a bureaucratic ritual, and it should be an interaction and not a transaction. For these reasons, we as reproductive endocrinologists, as attorneys, and as health psychologists are concerned about whether patients understand ART's risks, benefits, and side effects. We need to know whether they read the forms or sign them without reading them, potentially without understanding that information. We need to know whether consent processes effectively protect clinics and patients. To answer these questions, clinicians in other fields have begun to design new informed consent aids, like interactive applications with quizzes. These applications have been connected to greater recall and comprehension, actually greater patient satisfaction, and improved treatment relationships. They might also be more consistent and effective than consent documents. These applications are never intended to be substitutes for informed consent conversations, but designed effectively, they can meet the systematic, expeditious, and cost-effective standards that ASRM advocates.